Beyond the Stethoscope brings you inside the conversation shaping healthcare across Pennsylvania, Delaware, and Maryland. Each episode features physicians, clinical leaders, and frontline colleagues sharing insights about how care is evolving and what it means for patients and families in our communities. I'm your host, Adrienne Kiss. And today we are talking about a question many people face in real time, often when they're stressed and not thinking clearly. When should you go to urgent care, and when should you head straight to the emergency department? I'm so thrilled that joining us is Kim Fortson, Director of Nursing for the Emergency Department and Patient Flow at St. Mary Medical Center in Langhorne, Pennsylvania. In this conversation, we're shining a spotlight on what you should know about seasonal illnesses, injuries, and prevention, and how you should know in which place to choose when seconds count. Thank you so much for joining me today. Like I said, I am thrilled that we get to have this conversation.
Thank you for having me.
Yes, absolutely. So I understand that you have 20 years experience as an ER nurse.
I do.
That is incredible. Would you mind to just tell me a little bit, and like you were saying earlier in our conversation, ER nurses are succinct. So just sorry to rush us already, but I would just love to hear a little bit about your past.
Of course.
Thank you.
So I got my career started at the University of Pittsburgh. That's where I got my degree. I did lots of things. I did travel nursing for a bit. And then I started at an emergency department, stayed there for 10 years as a clinical lead. And I was like, you know what? I want to do more. I want to be able to help shape the future nurses. And so I went back to school, got a double master's, and then became a manager at St. Mary Medical Center Emergency Department. And then a year and a half ago, I am pleased to say, I am now the director.
That's wonderful. So your expertise really is kind of over this broad world of emergency care. Would you mind to just tell, for myself actually, and for our viewers at home, the difference between urgent care, which I'm sure we've all been to one time or another, and emergency care?
So a very simple way to describe urgent care, I would say convenience, right? So if you have a sore throat, if you have flu-like symptoms, things like that, that's urgent care. When you think emergency room, you think emergency, life-threatening injuries. That's when you come and see us.
Okay, great. That to me makes a lot of sense, but I know that some of us, there can be some misconceptions. Are there things that you hear a lot, maybe when you were interacting a lot with patients, or just anything you'd like to clear up now that we have this megaphone of our great podcast?
Of course. So one of the misconceptions is that people do not want to burden us with coming, and they tend to wait, and they worry about wait times, and they worry about the cost. Those are the things that people should not worry about. And if there's uncertainty or if they're unsure of their symptoms, that's what we're here for. So
okay, great. That's really good to know. So we're heading into the summer months, right? And so I think a lot of us, as we get outdoors, there's more backyard barbecues, kids are climbing all sorts of things. So let's use actually a child falling as an example.
Okay.
Maybe they're bleeding a little bit. I think a lot of us know that head wounds can bleed, but what would you advise somebody in those split seconds when they're making the decision between urgent care and emergency care?
So pediatric patients specifically, they have a lower threshold, right?
Okay.
And so they can decompensate and decline very quickly.
Okay.
So if a kid with a fall, just from standing, that's, and they're acting normal and there's just a bump, that's okay. And that's probably, you can see your pediatrician. But if there's a big significant fall, if there's a big lump, if you're bleeding, there's confusion, if the baby now is altered, projectile vomiting, you definitely need to come see us at the ER.
Good. I think, I really liked that example. Thank you, because you kind of covered a lot of territory as well. How about a lightning round? Because we just went through the fallen child, and that was but we could literally just say urgent care or ER.
Okay.
Chest pain.
ER.
Trouble breathing.
ER.
Broken bone.
Okay, well, that's controversial, right? So
interesting.
You can go to an urgent care for a broken bone.
Can they reset it?
So they have the ability to have x-rays. They will splint. Most of the time when you have a broken bone, you have to wait for the swelling to reduce before any surgical interventions can happen anyway. However, it would depend on the bone, I would say. So if you're unsure, come on over to see us at the ER.
I love it. Uncertainty ER. Great.
That's right.
How about a sprain?
Urgent care.
Head injury.
ER.
A cut that might need stitches.
So a minor cut is definitely urgent care, but if there is severe bleeding, absolutely come to the ER.
ER. Severe stomach pain.
ER.
Dehydration.
It depends. So if it's just a minor, you're feeling dry, urgent care is fine, absolutely. But severe dehydration, absolutely need to come and see us.
So like if you're feeling faint, like passing out.
Absolutely.
Okay. Allergic reaction,
ER.
flu-like symptoms.
Oh, urgent care. Urgent care.
I know. It's like, don't be clogging up my waiting room. Thank you. So based on the above, would you say that this changes with different age groups? I know we talked about kids earlier. Also, many older adults might be just put into a different group. How would you address those two different kind of differentiators of
So
age?
if you're young and healthy, not pediatric, but young and healthy, like you and I,
Yes.
then you would definitely, you could definitely probably have urgent care more on your forethought. But our elderly population, they typically will come and see us at the ER, and that's okay. We encourage them to come see us.
That's good. I'm sure you kind of like having that touch point with older adults. Are there any certain situations that you would just go straight to the emergency department, like not even consider urgent care?
Crushing chest pain, you come see us in the ER. If you're having stroke-like symptoms, right? Facial droop, slurred speech, change in mental status, worst headache of your life, you come see us in the ER. Without hesitation, do not stop.
Just don't
Come
hesitate.
to
And like
us.
you said, I love how you addressed that misconception earlier when people don't want to burden you. I think people really do. It's like,
That's what
just
we're
kind
here
of go
for.
through that mental math, but it's like you guys it could be seconds of life-saving care. Do you see, as we head into the summer months, more certain types of illnesses or injuries in those warmer months?
Oh, of course. So when you're outside, sunburn, you have to remember to apply sunscreen. And when people are out having fun, no one thinks about drinking water or taking time to rehydrate. So
Right.
dehydration is absolutely something that
see a lot
people
more.
need to pay very much close attention to. And then, there's lots of barbecues, so lots of burns,
Oh, you're right. Yeah.
pools, drownings. We need everybody to make sure that they are aware of their surroundings and keep an eye on everybody at all times.
On those kids. Yeah, absolutely. What would you say, this is kind of in the same vein, what sort of prevention do you recommend to keep people out of your emergency department?
Sunblock is number one for summer activities. Hiking,
simple, yeah.
beach. I mean,
Yeah.
overcast, people are like, oh, the sun's not even out. I don't have to worry about it. That's when you have to worry about it the most. So please reapply to yourself and your children while you're out and having a good time. Remember to take breaks to rehydrate no matter what you're doing.
That's good advice. All right, so I'd like to shift gears a little bit towards another big aspect of your job, and that's the importance of CPR.
Oh, yeah.
Do you mind to tell me a little bit more about how that fits into your role?
Okay, so CPR is it's a life-saving. Literally, it will patients will survive 2 to 3 times more likely if somebody provides CPR to them.
Wow.
And those minutes before EMS arrives are critical. And if you know how to do CPR, you can make the difference in saving a life. So, a lot of people think that only healthcare professionals can provide CPR. That's not the truth. I encourage anybody who's babysitting our teenagers that they should go and get certified in CPR. Anybody who works with children, anybody, even a grocery store, everybody I feel should have the ability to provide CPR and learn how to use an AED, because those are the things that will save someone's life in a split second. And no one realizes that they can make a difference without being a healthcare provider.
Where would I go to get more information about CPR training?
I would always recommend American Heart Association,
Okay.
and that's where I would go.
Okay, great. As we wrap up our conversation, is there one takeaway for our viewers? We've covered a number of topics here, but anything parting words you'd like to leave us with?
Do not hesitate. If you hesitate for just a moment, that can make or break a difference in saving a life, saving your life. And if there's ever any uncertainty, come and see us in the emergency department. Do not wait.
I love that. Thank you so much. This has been so educational, so helpful for me, and I know everybody at home has enjoyed this as well. Thank you, Kim.
Oh, thank you.
Knowing when to choose the emergency department versus urgent care helps protect our healthcare system, and knowing CPR, as we heard today, helps protect each other. Preparation starts before an emergency happens, but emergency departments are open 24/7 to care for the communities that we serve. Thanks again for joining us for this episode of Beyond the Stethoscope.